you. Thank you for the invitation. And so I'm just going to share with you with our organization up in New York, North Shore-LIJ, as you can hear by the accent. Born in the Bronx, raised in Queens, um, is doing around lifelong learning, workforce development, and within that context, um, encouraging and supporting nursing certification. So let me just give you an overview of who we are. We're pretty big. We're the largest employer in New York State. We're also the largest health system in New York State. We have close to 48,000 employees, 5 tertiary campuses. I won't go through the whole thing. We are highly integrated. We know there is one person that signs our paycheck, all 48,000 employees, Michael Dowling, our CEO and president. This is not a loosely integrated, affiliated organization, but highly integrated HR policies, quality, physician quality as well, everything straight across the board, every hospital, same way. So we've been working on that for the past decade. This is what we look like today. We have we're not just hospital-based, we have our clinical enterprises, which is our inpatient and outpatient facilities. And then we have a large educational enterprise. We have 120 residency programs. We have a brand new medical school. We're one of the new 11. We have our first graduating class next May. We partnered with Hofstra University to develop that medical school. And if all goes well with the board meeting next week, we are going to be developing a graduate school of nursing so that we have this opportunity to have medicine, nursing, and Hofstra has a PA program. And we're putting them all under the same leadership structure, and we'll have a great opportunity for interprofessional education. We have a very large research institute, the Feinstein Institute, with 1,500 scientists and investigators. And our Center for Learning and Innovation is our strategic commitment to lifelong learning and workforce development, and I'll get to that in a second. We have our new enterprises. We now have an insurance company. And so we went on the exchange when the day the exchange opened up, and I think we were up for about 2 or 3 minutes and everything crashed. Along with everybody else, along with the rest of the country. But at any rate, that is something new for us, and so we are assuming all the risk for all of our patients. And then we have our community health enterprise, and we also have a new venture group within the health system. So I won't go through this. I think there was a similar slide before. We've been probably the last 8 years or so going through this massive transformation in the health system. It's a very big ship to turn around just to prepare ourselves for the new landscape. But something that's very central to this and that the organization is committed to is to have a high quality workforce, because we know right from the get-go that unless our workforce is really high quality, we'll never be able to make this transition. So when Mike Dowling became the CEO in 2001, the year before, he wrote a white paper on a leadership institute and made a commitment and investment back then to lifelong learning and workforce development for all 48,000 employees. And he also wanted to bring the role of the chief learning officer into healthcare. It's something that GE and Motorola and Fortune 100s had. So I was the one that was lucky enough to get the job nobody ever heard of, and then try to figure out what to do about it. So this is what we have today, our Center for Learning and Innovation. We have our Patient Safety Institute, which is housed in the Center for Learning and Innovation. It is a very large interprofessional clinical simulation center. Actually, we just had a book published about it, just to share our story and journey with that. We have 90 of our clinical teams that are regularly scheduled that come through. Different curriculums for each one, whether it's perinatal or emergency medicine or whatever. And then we have our, what I would call our business school. We have our leadership development programs and our high potential programs, so that we continue to create a pipeline of leaders in our organization. Our bioskills center is also a cadaveric lab for surgical training. We are a New York State EMT and paramedic training site, so we also have those programs, and we have the largest EMS department east of the Mississippi. We have 600 EMTs and 650 EMTs and paramedics in our health system. There's a medical school, and I won't drag you through all the gory details there, but for an organization that was never housed in a university, we have a lot of academic activities going on. So that's just another quick glimpse of our Center for Learning and Innovation. We also have a whole section on improvement sciences where we have all sorts of categories of employees, being nurses, physicians, administrators that are Six Sigma and Lean black belts. They also have the skill sets around microsystems, and we also have engineers embedded in those teams to help us redesign and transform our clinical practices. So our commitment to the future of nursing blueprint, we'll start with the first one, and I'll just touch upon these as we go along. So the commitment to specialty certification, we have paid differential that we give to every specialty certification. Last year, I had actually HR run this report last week. So it was up to the payroll of August 30th. We paid out $3 million in certification pay for all our RNs. 29% of RNs hold at least one certification, and 11% hold more than one specialty certification. So we are fully committed to that, with or without the research. Just makes sense to us. 73% of our nurse practitioners are board certified. Our critical care nurse fellowship program prepares fellows for specialty certification. Now, our critical care nurse fellowship program, and I believe I had given Karen our 2 articles that we had in Nursing Economics about the outcomes of those programs. This is similar to the nurse internship programs that the IOM recommended. So these are new nurses that are being hired for our critical care specialty units. We have a year-long program to close the gap between school and being ready to work in our critical care units. And of course, we use the core curriculum from the AACN for emergency nurses fellowship. We use ENA's core curriculum, et cetera, et cetera. So that's a whole program that includes mentoring, socialization into the unit. The published articles can give you all our organizational outcomes have been extraordinary in terms of retention, quality, et cetera. And now we have fellowship programs, not just in critical care and emergency department, but pediatric ICU, pediatric ED, perioperative services, maternal child, et cetera. 25% of our nurse fellows are specialty certified. And our clinical ladder, we have a clinical ladder in the health system. There are value points added for specialty certification to move up that ladder. So why make this commitment? And this is so this is not just related, these assumptions are not just related to nursing, but to our physicians as well. We think it makes a difference. Knowledge, clinical skills, and clinical judgment. Anders Ericsson work demonstrates that evidence suggests that clinical skills deteriorate over time. Certification, we are making the assumption it is a proxy for competence. We believe it facilitates ensuring that nurses can practice at the full extent of their education and training, and we believe that it also enhances professionalism. So advancing nursing credentialing research important, but I will just echo what my colleague Susan has just said, but it's not essential for organizations like mine to make the decision to require, encourage, foster, and financially support specialty certification. We have no intentions of waiting that long now. Until you come up and tell us to do something else, we will continue to support here. So, somebody mentioned crew resource management earlier this morning around aviation. And crew resource management came out of after the airline disaster in Tenerife, where KLM went into Pan Am. And Robert Heimerick, who was one of the key developers of CRM, they developed that for aviation. So that air disaster took place in '77. It was implemented in '79 throughout aviation. Well, there's no research to support that. And they still use it today, and now we're adopting it. So research is important. However, you don't always need to wait for that to validate what your assumptions are and what your gut tells you think you need to do. The other thing, anytime this question comes up, I always think, well, we require our physicians to be board certified. Why would we require anything less of nurses? So it's almost like a no-brainer. So just a couple of other things, and expanding the opportunities for nurses to lead. We have a lot of programs in our Center for Learning and Innovation, and also in our Nursing Institute, where our nurses as part of teams have the skill set of improvement sciences to go out into our organization to do quality improvement initiatives. The nurse residency programs, we actually implemented that critical care fellowship program back in 2005. My CEO had this crazy idea and gave me HR as well. So while I was there for 6 years, I went through a lot of data and found that our new nurses going into the specialty units, the turnover rate in 6 months was 65%. A lot of money, among other things. And that's why we took the back of an envelope and thought, well, we need to do something else, and we developed the fellowship programs. And we have great outcomes. Increase the proportion of nurses with baccalaureate degrees. I was probably about 5 or 6 years ago, our chief nursing officer and the nursing leadership in the health system went to the CEO and said, we need to do this. So for the past 6 or 7 years, all new hires are baccalaureate nurses. Any associate degree nurse in our health system has 5 to 7 years to get their baccalaureate. We're happy to pay for the whole thing. And if you're not a nurse in our health system and would like to become a baccalaureate nurse, we'll also pay for that as well. Double the number of nurses with doctorates. So we're doing a little piece of this. I was happy to be able to convince the CEO to send, I think the number is 68 nurses to Case Western for their DNP. We did that. We started that in 2006. I think 3/4 have graduated already. The outcomes are spectacular in terms of published articles, moving these DNPs into leadership positions, et cetera. So that was a good idea. That worked. And of course, to ensure that nurses and all our employees engage in lifelong learning. That's the whole point of our Center for Learning and Innovation. And that number 8 is definitely an HR piece in our organization. For us ourselves to do that around our interprofessional healthcare workforce. So I have a couple of seconds here. I just want to share a personal story. And so up until I became the chief learning officer about 12 years ago, I was in emergency medicine. So I'm an emergency nurse. I also started in nursing back in the early 70s as an LPN. So I've been every nurse at every level, so I can talk about anybody. So I was an LPN, associate degree, baccalaureate, master's, PhD. And I was always very proud as I moved up the ladder. I always knew getting to one level was like just a little bit more of a ticket to admission to the next level. But when I became certified, when I became a certified emergency nurse and a certified critical care nurse, and I had CEN, Gallo, CEN, CCRN, it was an inflection point in my career. And it actually transformed me personally. And I felt like I was empowered to practice at the standards set by those specialty organizations, and I was held accountable to it. And I don't know that folks nowadays have that same feeling. But I think it makes a big difference, and for us to encourage young people, or next generation, to pursue specialty certification. Whether the employer does it or not is not important. I tell nurses, we pay for it. I used to work in an organization that didn't. Don't let an employer, be in control of your level of professionalism. So it's important for us to get to the individual as well as to the organization. So I'll stop there. Thank you.
Thank you so much, Kathleen. Our next speaker is Kenneth Kaiser, who is the director of the Institute for Population Health Improvement at UC Davis Health Systems and distinguished professor at University of California, Davis School of Medicine and the Betty Irene Moore School of Nursing. Dr. Kaiser is also a member of the Institute of Medicine as well as a planning committee member for this workshop. And Dr. Kaiser will be talking about developing a national focus. Thank you.
Thank you.